Everyone. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign, and always great to be here with you all for our monthly webinars. And this is our quarterly forum with the Cabinet for Health and Family Services leadership. We're very grateful for their time today. Most of you I know are familiar with Thrive Kentucky by now, but for those of you who are just joining us for the first time, our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting those basic needs. And we have some guiding principles. If we can go to the next slide. These are the guiding principles that really help us to kind of focus our work on what is the policies that we think will make the biggest difference for all Kentuckians, to level the playing field, to really focus on equity and making all of these public assistance programs that the cabinet administers work for Kentuckians and removing barriers and making sure that people are thriving. So we can go to the next slide. If you want to know more about any of our members, the members of Thrive Kentucky, these are hyperlinks. You're going to get these slides as a follow-up to this webinar. You can click on any of these to learn more about any particular organization. And we can go on to the next slide. Always want to give a big thank you to our sponsors. Our sponsors make it possible for us to do these webinars on a monthly basis for free and to provide CEUs for certified community health workers, for social workers. And we've also been doing, if you haven't already joined us, a roadshow where we come in person to communities across Kentucky and provide a longer presentation and training on advocacy and all of these safety net programs, all the different components of Kentucky's safety net. And the things that we need to thrive and how we can better advocate for our communities. So we have one more of our roadshow, well, actually two, one in person in Paducah this month, the week after Thanksgiving. Let's go to the next slide, Alex. I don't know that we actually have it here. I think it's at the end. And then we also have a virtual roadshow that we're planning for December. So we'll get more of those details to you. Oh, thanks. And these are also hyperlinks that you can click on to register. So we just passed the agenda for today. Thanks. After the last couple of forums, which were really packed full of great information, we've tried to dial it back a little bit today with fewer topics so that we have more time for discussion and questions. Today, we're going to have some updates on the interim legislative session, the upcoming legislative budget session, childcare, earned income tax credits, food assistance programs, Medicaid renewals, some new Medicaid covered services that are exciting, and Medicaid waivers to support people with substance use disorder during incarceration and reentry, and for people with serious mental illnesses who need supportive housing. So we're going to be addressing that in the next 90 minutes. To discuss all of these topics with us, we're really delighted to have on our call today Medicaid Commissioner Lisa Lee, Medicaid Senior Deputy Commissioner Veronica Judy Cecil, Medicaid Deputy Commissioner Leslie Hoffman, Director for the Division of Long-Term Services and Supports, Pam Smith, Director of the Division of Family Support, Todd Trapp, Division of Child Care Director, Andrea Day, and Department of Aging and Independent Living Division Director, Marnie Mountjoy. And I hope that I haven't missed anyone. If I have, we'll make sure to introduce you later on in the agenda. So again, this is the agenda. Our goal as always with these forums is to create more open dialogue between cabinet leadership, consumers, and advocates. We really want these webinars to be an opportunity for you to get updates on our safety net programs, to share feedback, to ask questions. So during each of these sections, if you have a question or a comment, feel free to put that in the chat as we go. We'll try to cover them. And anything that we don't cover, we will include in a follow-up. We actually include the chat and lots of resources in a follow-up email, so you can watch for that in the next day or so, along with the recording and the slides. And just some quick housekeeping before we begin. Please be sure to mute your line. Use that chat if you can. If you need to ask a question that's a little complicated for the chat, we can also unmute, but if you can keep that mute on while we're all talking, that would be great. We're recording the webinar, like I said, so you'll get that along with an evaluation in the follow-up. And we really appreciate that evaluation because we need your feedback for future webinars. And then if you are a certified CHW or a social worker and you'd like to receive CEUs for attending today, you can email Kelly, and Kelly will put her contact information in the chat. So with all of that, I'm going to start us off with some updates on the interim session that's just starting to wrap up now. And we'll also talk just a little bit about what we can anticipate for the upcoming 2024 General Assembly that starts on January 2nd, which is really just not that far from now. Kind of hard to believe that we're so close to the end of the year. So having 2024 being an even year means that we're going to be having a longer biennial budget session with 60 working days. And that feels a lot longer than 60 days when you get into it, because it ends up being from, January to mid-April. And while budget sessions, have it's threat and opportunity, but we have a real opportunity here to advocate for the programs and resources that Kentuckians need to thrive. If you join any of our other webinars or that monthly roadshow that we do, you would hear from our colleague Destin Pugel about all the funding that we have in our budget, that in our rainy day fund specifically, and the funding that we really should be using to support these programs. And that's really where we're going to have to be putting so much of our advocacy in this upcoming session. I know the cabinet is working on budget requests right now. It may be too soon to share many details about those requests, but we definitely do want to hear from our cabinet leadership what we can be doing to build support for funding, and how we can be working on that together. And then something else to cover, there have been a number of task forces meeting during this interim session. These are really special committees that are held on specific topics. And we'll be seeing reports, and recommendations coming out of those task forces soon. But today, we want to really look back at some of the reports that were due from the cabinet just this month, based on things that were passed and discussed in last year's task forces and committees. So one of those is House Joint Resolution 39, the benefits cliff. And that was a look at how benefit eligibility and assistance levels could potentially be restructured for families and workers as they earn more income, rather than causing them a setback. If you earn more, you end up losing benefits that you just simply can't replace with that small raise that you might have gotten. So any updates we can get there. And then Senate Joint Resolution 54 to apply the area deprivation index to Medicaid reimbursement to more equitably reimburse care in underserved areas. Those are two that we're really focused on now. And I think, pass it to Commissioner Lisa Lee first to give us some updates, and then we'll go from there.
Thank you, Emily, and thank you for having us here. Always good to have this partnership and these conversations to keep everybody informed. As far as House Joint Resolution 39, that was passed in the 2023 regular session, and it instructed the cabinet to identify flexibilities permitted under federal laws to tier benefits or gradually phase out benefits as a member's income increases. That's, as Emily referred to, the benefit cliff, because most of our programs are based on a federal poverty level scale. When an individual makes more money than allowed on that federal poverty level limit, then they do lose benefits. So we did create a report that was submitted to the General Assembly on November 1st of this year. And so the report does contain some information, particularly what we have been doing to help alleviate some of that benefit cliff issue. There's some information in there specifically related to SNAP, the KTAP program, the Kentucky Transitional Assistance Program, the Low Income Home Energy Assistance Program. And I think that Todd and Andrea may be able to speak a little bit more to that. But as far as Medicaid goes, some of the things that we have been doing and we've already implemented to help assist with that benefit cliff, for example, is continuous eligibility for children, which we are very excited about. Continuous eligibility for children means that children under the age of 19 are going to be enrolled for 1 full year, regardless of a change in circumstance. The only way that they would be disenrolled is if their parents requested they did be disenrolled or they move out of state. But we're very, very excited about that extension of, or that continuous eligibility for children. We know that that's going to keep individuals, particular children, some of our most vulnerable, enrolled in Medicaid for that full year. Another thing that we did to assist with the benefit cliff, of course, was an earlier adopter of the postpartum extension of postpartum benefits for pregnant women. Typically in Medicaid, when birth occurs, then the individual only had Medicaid eligibility for 60 days. With the expansion of the maternal or the expansion, I just used the word, but now in individuals, women will have 12 months of continuous eligibility postpartum. So that again is a really big benefit. Another thing that we did, I'm not sure that we've talked about in this forum yet or made people aware, is that states are allowed to cover pregnant women in KCHIP. Kentucky adopted that provision, that policy earlier this year. So we expanded. Typically, pregnant women were enrolled in Medicaid. The federal poverty level limit was 185% of the FPL. Now it's 218% of the federal poverty level. So we will be able to enroll more pregnant women and keep them enrolled because they also are covered under that 12 months postpartum. So after they deliver a child, they will also be included in that 12 months postpartum. So we're very, very excited about that. Another topic or another policy that we put in Senate Joint Resolution or House Joint Resolution 39 is, previously we had talked about a basic health plan. A basic health plan is something that would be able to assist in covering individuals when they fall off of Medicaid. It would kind of look like Medicaid until they were at 200% of the federal poverty level. And then they could move into a plan on our state-based exchange Connect. We haven't gotten a lot of movement with the basic health plan. We did look into it, but it's not something that I don't think is being considered at this point, but that would be something else that could be looked at to help with that benefit cliff. Of course, our state-based exchange Connect is also in place that allows those individuals who lose Medicaid due to increases in income. They can go into a plan on the exchange with an advanced payment tax credit. So we've done a few things in Medicaid to help alleviate that benefit cliff for Medicaid members. And Emily, if you'd like, I could turn it over to Todd and Andrea if they want to talk a little bit about some of the other topics that were in House Joint Resolution 39.
Yeah, absolutely. And I just want to say before we do that we are very supportive of a basic health plan. I think if we had one right now, the renewal process, Medicaid renewals would be going a little more smoothly for the people who need to transition to another plan. And so we will be advocating for that in the upcoming session if anyone is interested in working with us on it.
Todd or Andrea, I'm not sure who would want to go first, or if you want me to speak on some of the other
I'll be
topics.
happy to go.
Okay, Andrea, thank you.
All right, thank you. And thank you for allowing me to speak today. As many of you know, childcare is one of the greatest cliffs a family will face. We estimate that on average, childcare costs $1,500 a month for one child. So that comes out to about $18,000 a year. And, that's a tough pill to swallow if your childcare has been covered. We've done a number of things using the ARPA money, the one-time CCDF discretionary funds. I've joked that, we turned everything up to 11 when it came to our program. We increased our eligibility from 160% of the federal poverty guideline to 85% of the state median income, making more families and children eligible to receive CCAP coverage. We've also switched to paying our providers based on enrollment versus attendance, which is more in line with what private pay families, how they pay for childcare. It doesn't matter if your child's there or not, you're holding that spot. So by us switching to enrollment versus attendance, that gives our providers some additional financial stability to be able to keep their doors open so that we have greater childcare capacity across the state. We are also paying our providers at a higher reimbursement rate. Prior to the pandemic, we were paying at the 40th percentile of the market rate survey. So that meant we were paying 40% of what the market could handle, not necessarily, what it actually cost to provide quality childcare, but what the market could handle. We upped that to the 80th percentile of our market rate survey, which was a huge increase. And again, something to help our providers be able to stay in operation to provide that critical services to families. That is something that we are very hopeful to continue post-pandemic. Again, as Emily mentioned, the cabinet has made some budget requests. All eyes are on childcare. There have been a number of not only the task force, but there was also a work group through Education and Workforce looking at the benefits cliff, who are also recommending that we keep all of these measures in place. Again, it leads to healthy and successful families and children. Overall, it's a concrete support. Some of you have heard me say before that we really need to switch the way we think about childcare. Is it expensive? Yes, it is, but it's an investment, and it's an investment in our future. And if we can change the way we think about childcare as a concrete support to support families and children, it's kind of that ripple effect with early intervention, school readiness, high school graduation rates, post-secondary education rates, as well as workforce participation. So that's really where we are in childcare, is trying to have folks reimagine how they think about childcare, and that it is really a prevention measure and a concrete support to families. And it's something that we really need to invest in, and that the cabinet, will be advocating for. Todd, I don't know if you want to talk about the Division of Family Support.
Certainly. House Joint Resolution 39 required us to take a look at our programs. Luckily for us, we'd already sort of taken a look at the TANF-funded cash assistance program here in Kentucky, KTAP, and we actually implemented changes that address the cliff effect for the KTAP cash assistance program earlier this year. And those changes include increasing the income limits, increasing the monthly benefits, and also in implementing, actually we already had an earned income disregard in the KTAP eligibility deduction, benefit calculation, I should say. We increased that to 6 months. And in addition to that, we added a 6-month 50% disregard of the income. And so what that means is a KTAP household, or a household receiving KTAP benefits, can, at the start of new employment, we will disregard that income for 6 months, and then we'll disregard half of that income for another 6 months. So basically, they'll have a whole year to sort of get on their feet, so to speak, before their KTAP benefit, that monthly KTAP benefit, should discontinue. And along with that KTAP benefit comes a lot of supportive services associated with the Kentucky Works program, which is the work program designed to help those KTAP recipients meet their work requirements required by the TANF block grant. So we increased the monthly transportation assistance for Kentucky Works. We increased the amount of supportive services we are able to pay through a 12-month period for those individuals as well. So those are all steps we were able to report on, include in our report for the benefits cliff. And then for SNAP, the same thing. We had already taken a look at the SNAP program. SNAP itself is designed to incentivize income or employment, I should say, by the deductions for the earned income deduction and the fact that you can deduct out-of-pocket childcare expenses. Both of those things mean that earned income households with earned income, their benefits are reduced less than the unearned income, than the effect unearned income has. So that's one thing. And then good about the SNAP program in terms of the benefits cliff. And then also we are implementing a oh heck, what do we call this thing? It's it's in conjunction with the KTAB program. When earnings increase and a household's KTAB discontinues, we're going to lock in their SNAP benefit for 5 months. Now we haven't implemented this yet. It's in the process. We are just, it's transitional benefit program. Thank you, Tyler. It's in process, and this will be something really good for those KTAP households. So those are the changes we made to the TANF funded program and to SNAP. In addition to that, the House Joint Resolution 39 required the cabinet, the department, I think, specifically to implement an earned income tax credit awareness program. And so we worked with the Kentucky Chamber and our Office of Administrative and Technology Services, and I think Kentucky Revenue as well, on an earned income tax credit awareness program. The first thing we did was implement a notice that we send out to all public assistance households, just making them aware of the program, making them aware that that's extra funding they may not be taking advantage of, extra income to their household. And so we have that notice in place. We have a separate notice designed in a similar fashion. And through these two different notices, well, through that first notice, I think we provided that awareness notification to 500 and I think over 500,000 individuals. So that's already been pretty impactful, and we still have work to do with that work group. So that's where we're at with our programs and with our earned income tax awareness. So back to you, Emily.
Thanks, Todd. These have been really helpful updates, and I'm sure not everyone is aware of all the work that y'all have been doing. So thank you for making all of these improvements to the programs that you had the authority to do. And we're looking forward to seeing the full report on the benefits cliff that you all put together. One thing I wanted to ask, you'd mentioned, all of the kind of the toolkit you have on earned income tax credit. If that's something that you could share with us, whether in the chat or maybe just as a follow-up, and we can get it out to the group, if that's information they can spread in their communities. We also worked on an explainer with our Thrive Kentucky partners around the new KTAP changes. So we'll put that in the chat because it's good information, and we want to make sure that people are taking advantage of that and reconsidering whether or not it's worth applying for. So definitely want to see enrollment go up there. I wanted to just very quickly, before we move on, touch on something that is, unfortunately, a kind of a looming deadline again, this federal shutdown, or the threat of a federal shutdown on November 17th. I feel like we have talked about this on way too many of our monthly calls this year. This is becoming, a pattern, and without having a bipartisan funding agreement in Congress, we're going to be facing, programs that are unable to operate, potentially funding that may not be flowing. And just wanted to hear from the cabinet what the impact could be for Kentucky if we do have a shutdown. Hopefully it will be averted. And of course, we all need to be advocating for that to make sure that our members of Congress know that they have a responsibility to keep the government running. But can you just quickly tell us what is at stake there?
So as far as Medicaid goes, we don't believe there'll be an immediate impact to the services that are being provided. Now, if a government shutdown lasted, maybe 60 days or so forth, we think that, it could potentially impact the Medicaid program, particularly as it relates to payments to providers. But as far as our other programs, I'm not sure if Todd or Andrea have any insight into how it may impact the programs in their areas.
One thing I can share is in terms of the program's family support administrators. I believe SNAP would be the first impacted, and that would not be until I think at least 30 days into a shutdown. When we experienced this before, I think about what's it been now, about 4 or 5 years ago, what we had to do for SNAP was actually make that next month's benefits available, have an availability date on those benefits a month prior to what it normally would have been. But because FNS has changed the way they define obligated, I think, of those benefits, we won't have to do that at this time. And so that means should we experience a shutdown, that next month's SNAP benefits that are already applied to a card will be available to those households. And so now beyond that, there would be question marks, and it would, be situational then as to how many months down the road. And the same, I think, would be said after, as Commissioner Lee said, once we get out to the 60-day mark, then other programs would be called into question as well. So that's what I know.
And that's the same for childcare.
All right, good to know. Thank you all. We appreciate it. I think looking at the time, we're going to go ahead and transition to our next topic on the agenda. So I'm going to hand it to Tyler.
Great. Thanks, Emily. Tyler Offerman with the Kentucky Equal Justice Center. We're going to talk a little bit about feeding programs and food insecurity, and got several folks here to share some information with us. But first, I was recently struck by the data, excuse me, that USDA released about food insecurity. This is the first real data we've gotten for 2022, so sort of on the, quote unquote backside of the pandemic. And it shows a pretty staggering increase in food insecurity and poverty, especially among children and older adults across the nation. I got a little graph here I'll share with folks that shows some of that data, but I know the Cabinet Family Supports, Dale, Department of Aging and Independent Living, and several other Cabinet agencies are administering some pretty important feeding programs right now, especially as we see this, again, really staggering increase in hunger and food insecurity across the nation, and especially here in Kentucky. And I've heard anecdotally from some of the people on this call, but also food banks, pantries, that they're seeing, numbers like they've never seen before when it comes to folks seeking food assistance. So interested to hear in the viewpoint that y'all have in the Cabinet and what you're seeing. And we're going to talk a little bit about senior meals and then SNAP and some of the other programs. So with that brief, sunny intro, Marnie from the Department for Aging and Independent Living would love to hear a little bit about how the Senior Meals program is going.
Absolutely. Thank you so much for the opportunity to speak to the group this afternoon. I am with the Department for Aging and Independent Living, and we offer a variety of programs. In particular, the ones that I'm going to talk about today are those that are programs that are focused on those who are 60 and over. that are living in a community setting. So we operate the senior nutrition program. And again, it's for anybody over the age 60 or over. And we kind of have two components. Those meals could be provided in a senior center setting, or they can be delivered to the home. So we have those two programs. And through some additional funding that the governor and the legislators bequeathed to us these last 2 fiscal years, we had an additional $14.4 million that we were able to invest into our senior nutrition program. And we actually call it ESMP, Expanded Senior Meal Program. So this last fiscal year, we provided an additional 1.2 million meals to seniors across Kentucky. And we're, like I said, we're very fortunate to have those funds. We have funds that are available to us through the federal government to support senior nutrition, but this was a funding source that was state funds that we were able to receive. And we've done a lot of great things. It's not just the traditional providing the meal to the senior in the home or at the senior center. We've been able to do some innovative things, such as some mobile meals, or motor meals is what it's called, motor meals, in the Gateway region, where a food truck of sorts is taken out into community settings. So we're bringing the meals to the local communities, those underserved communities. We're also working to do that in the Kentucky River region. And I believe next Tuesday, they're having a kickoff at the Buckhorn High School with their food truck that will be available, that they're going to be starting to use in the Kentucky River region, taking the food truck out in the communities and preparing those meals out there. So we're really excited about that. Having these additional meal dollars just means that we're able to reach more seniors, and we don't just provide them with a meal. We provide them with information. We provide them with information about vaccines. It's open enrollment time, as everybody is aware. So we've been providing information about open enrollment. And we just see the meals as kind of an entry point to get folks interested. We do administer the senior nutrition program through our 15 area agencies on aging. And that's where the application process starts. So they can contact a AAA, as we call them, or they can contact their local senior center and start the application process. So like I said, a meal is available for anyone age 60 and over through the Older Americans Act funding, our federal funding source. It's an entitlement. So those are entitlement programs. There's no income restrictions for our senior nutrition program. So if anybody is interested, that's where it starts. Over the next few years, we're hoping to do some other things that are introduced through our nutrition program, but are related to other things. We recently received a grant from the Administration on Community Living to do a suicide prevention program. So we're going to be training our home delivered meal drivers on some warning signs for suicide and how to make appropriate referrals back to the community mental health centers, so we can make sure that we address those that are in need. And we're also starting some new programs where we are going to be working with senior centers and local nursing students through the local college systems to go to senior centers and help those seniors understand what their vitals are, do some blood pressure checks, some weight checks, and help them track some things. So the question in the chat is the mental health first aid. We're actually training them in the ASSIST, and I apologize, Applied Suicide Intervention, ASIST. I don't know the acronym off the top of my head, so I apologize for that. But we are using the ASSIST and the QPR, qualified or question, persuade, refer modules. We've been working with our Department for Behavioral Health in offering those interventions. And then just recently, we hosted our 4th Senior Hunger Summit. So we use this as an opportunity to engage people across Kentucky to help come up with some solutions to addressing senior hunger and food insecurity. And we welcome anyone to participate, and I'm happy to send that more information out. It's recorded, so I could send it out so you could see what we just had these last 2 weeks ago, I think it was. Time flies when you're having fun. So that's kind of what's going on in the Department for Aging and Independent Living Senior Nutrition Program in a nutshell.
Great. Thank you so much, Marnie. And yeah, please send us any information so we can send it in the follow-up materials. And Marty mentioned how you can sign up, but if you have any problems or questions, feel free and reach out to folks at Thrive and we can provide support and assistance. And I guess I just wanted to, before we transition, thank the folks at Dale for all the work that you're doing, especially around this issue. Kentucky has historically and continues to be one of the worst states in the nation for hunger for folks 50 to 59, and it's not very good once you get over 60 either. So it's definitely a population that needs support and faces unique barriers. So thanks for all your work. Great. Transitioning on, we'll now turn to Todd Trapp to talk a little bit about some SNAP updates and touch on summer EBT. So Todd, I'll turn it to you to talk to us a little bit about the SNAP work requirements, time limits, and I will quickly preface it by saying this is one of the most complicated parts of the SNAP program. Thrive has several one-pagers and handouts to explain the SNAP work requirements and time limits in more detail. So if you have any questions, feel free and ask, but just know we oppose this policy, and one of those reasons is that it is deeply complicated. So Todd, why don't you talk to us a little bit about these going back into effect now that the pandemic's over and some of the changes?
Yes, thanks, Tyler. I'll just start by just generally talking about the requirements. If you're an adult SNAP recipient, basically, and you're not working and you don't have a child in the household with you, you're probably going to be subject to the ABOD work requirements, able-bodied adults without dependents. And what that means is you can, if you are subject to those requirements, you can only receive SNAP benefits for 3 months in a 36-month period, in which 3 months in which you're not either working 20 hours or participating in some countable training or work type activity for 20 hours a week. So at the point in time an individual accumulates 3 non-compliant months in a 36-month period, they lose their SNAP eligibility. So these requirements went back into effect July of 2023. And so that being the case, the first month in the last, I guess, 3.5 years that an individual in Kentucky could have been disqualified for noncompliance was October of this year. That being if they were noncompliant July, August, September. So basically, that was something we were aware of and put the word out there. These individuals can meet their requirement by participating in the SNAP Employment Training Plan. That's one way they can do it. And so we have partnerships across the state that can help with that. But indeed, we've seen some disqualifications, or saw some in October. Another big change and another added complication, part of it a good thing, part of it not a positive in terms of the ABOD requirements. The age group was expanded effective, effective June of this year to be implemented by September 1st of this year. The age group expanded for those ABOD requirements. And so what the upper age level on that was 49. As of September, 50-year-olds became subject to those requirements. And then October, the first month of the new federal fiscal year, 51 and 52-year-olds became subject to those requirements. So we made the changes, the system-wise, to implement those requirements. And then we were tracking those individuals in the new age groups. We began tracking them as well for those requirements. And then the positive aspect of the change is 3 new exemption reasons were implemented. And so that's a good thing. So anybody who was an ABOD prior to September and is either served in the military or is experiencing homelessness or is under age 24 and former foster youth can be exempt from those requirements as of September 1st. And so we began collecting that information. We actually have in the SNAP eligibility system, we do know some individuals who may be experiencing homelessness, who are veterans, and we know some of those who are former foster youth. So if we know it, then we've applied those exemptions appropriately on their SNAP case through those matches of that against that information we know. However, we don't know that information for everyone. So if you all know of somebody who meets one of those new exemptions and has been disqualified, then they just need to report that to DCBS and we can apply that appropriately for them. And depending on when their case discontinued, there may be some avenue for us to be able to remedy that without a reapplication, just depending on the timing of it. So I just wanted to share that.
Great. So quick recap. SNAP work reporting requirements have been in effect for a long time. They weren't in effect for 3 years. They went back into effect after the pandemic ended in July. But because of that 3-month lag, these folks only just started losing their benefits if they didn't comply with that rule as of October. And because those 3 exemptions, homelessness, veteran, or youth aging out of foster care, are very new, the chances of them having updated that on their case file or even knowing that they exist is really the thing that we want to make sure to flag for folks. If you've got a client who meets one of those and they did lose their benefits, then that shouldn't have happened and we need to rectify that. Or just generally, again, very complicated policy. So if you need any help or if your organization needs any help, the cabinet is committed to conveying that information, and Thrive is certainly committed to support you to do that. Great. So I want to make sure we stay on time. So if we can try and move through these next ones quickly, and then I'll pass it over to the matriarch of public benefits, Sheila Schuster. But real quick on summer EBT. So this is a program we've talked a lot about. Folks might be confusing it with PEBT, which was for benefits during the school year. PBT is over, that program has ended. But summer EBT is a new permanent program going forward. Some of those benefits for last year are going to be going out soon, but then that program will continue going forward. So just wanted to get a quick update from you, Todd, on the status of the current year payments and then anything you wanted to say about moving forward.
Yes, just to be clear, you said PEBT's over. We actually, the largest issuance so far this year was made last week, and that was for the summer 2023 PEBT benefits. And I think about $67 million was issued to around 560,000 students. So now there's still there's still some cleanup to be done. So there still will be some additional issuances to follow. But, as I say, the bulk of it's gone out. And over the next few weeks, the last of those benefits will be issued. And so that will close the door on pandemic EBT. The summer EBT, which will be the ongoing summer benefit program, indeed, Kentucky does intend to implement that program in 2024. We, to date, are one of the few. We have not submitted our letter of intent. Let me say that we have it in process. That'll be going very soon. But and only a handful of states have submitted that letter, and we are the only state in the Southeast region that has expressed intent to implement the program in 2024. So I will say that we've got our letter in process. We have a plan of management for operation of summer EBT. It is due to USDA FNS by February 15th. So we're here closing out EBT and really getting ready to start on taking a closer look at that plan, focusing on that plan, getting that drafted so we can meet that submission date. I'm trying to think if there's anything else I need to. Essentially, summer EBT will be provided to any student who was eligible for the National School Lunch Program, either through an actual approved application for free and reduced lunch, or through participation at a CEP school where the whole school is eligible for the program. Now, there will be an application required for certain students at CEP schools if a student will be eligible if they are receiving one of several public assistance programs through the cabinet. If not, and they're at one of those CEP schools, then there will be an application required, and there will be more to come on that. I think for the most part, we should be in a pretty good place because we've had an application available for PEBT, and we've learned a lot through implementing PEBT. So we're certainly going to use that, leverage a lot of that knowledge and a lot of that experience as we move forward with our plan for summer EBT.
Great. Thanks, Todd. And yeah, there have been a lot of twists and turns with these programs over the pandemic, lots of changes year to year. And now that we're transitioning out of the pandemic response and sort of into this new, summer EBT is a program that folks have fought for many years, and now it's permanent. And it's meant to make sure families during the summer, when they don't have access to free and reduced meals at school, are getting some additional food assistance. So it'll be new. We're all learning together, but the fact that we're one of the only states in our region who's really committed to making sure it's being run, kudos to the administration for that. So last thing, real quick, skimming, EBT skimming. So there are several criminal enterprises out there who are trying to steal people's EBT benefits, and they're using ever sophisticated ways to do that. And just wanted to give you the floor real quick, Todd. We recently got approved to be able to reimburse some of those benefits. But if this happens to you or a client, what steps should people be taking?
Yeah, if this happens, you should just report it to DCBS as you would any change, report it through self-service or through the 1-800 number. So make that report, and we can basically it'll filter up, and then somebody will be back in touch with you. And we have a group in my division who works those reports, validates those reports, and then issues those replacements of SNAP benefits. So we've begun making those replacements, and we're working on a plan to replace stolen KTAP benefits as well. We receive those reports many times. If the KTAP's stolen, then the SNAP is as well, because there's almost always SNAP accompanying the KTAP program. And so if we've replaced the SNAP and put in the KTAP so far, we're keeping record of that. And once we have that approved, we'll be replacing those retroactively. So just wanted to make that plain. And then let's see, there's one thing I will say, Tyler, and I'll share this information. There's an app that SNAP households can use if they're able, put on their phone, that can help them keep track of their SNAP benefits. It can help them be able to change their PIN if they need to. And it's really helpful in terms of flexibility and being really nimble and flexible and able to respond if they, do experience anything like this. So I think we've posted that to social media, and I can share that back with you guys to share through your channels as well. And then I think we also have a little educational video that I can share at the same time. So just to help people be aware to, if you're using a machine or an ATM that looks like it's got anything applied to it, be aware of that. But I will say the program integrity branch, they say a lot of times they've seen these devices, and sometimes you wouldn't really realize that there's been something applied to this device. So they have become very sophisticated in their methods of theft. That's for sure.
Thanks for those updates, Todd. Very worrying. And we will continue to monitor this with the cabinet. But yes, if you see something, say something when it comes to your benefits being stolen. So without further ado, let me welcome the illustrious Sheila Schuster.
Thank you very much, Tyler. Good afternoon. I'm Dr. Sheila Schuster. I run the Advocacy Action Network. That's the Kentucky Mental Health Coalition and the 874K Disabilities Coalition. And we are going to talk about waivers, or sometimes called SPAs, State Plan Amendment. That's what the SPA stands for. And we have some hopefully exciting news on the waiver or SPA for people with serious mental illness around supported housing and employment. I would like to introduce Pam Smith, who's the Director of Division of Community Alternatives at Kentucky Medicaid. And Pam, I'd like for you to start with some updates. And one of the things that we want is to know what the current waitlist numbers are at this point on what we call the 1915C home and community-based waivers. So I will turn it over to you, Pam. Good afternoon. You're muted.
I managed to get the camera on, but not the mic. I'm going to say hi real quick on camera, and then I'm going to go off camera because I will just be honest, trying to look at different screens, I feel like you all will be looking at the side of my head. So I just wanted to say hi real quick before I
All right.
off
Thank
camera,
you.
not looking at the side of my head. And let me share. Let's see. So, and I think I got everything close in order of what that you had asked for. So let's see.
Oh, great. Thank you.
Can do
Thank
this.
you so much.
So our current enrollment, and this is as of this was as of yesterday. So you will see this big number here, the filled slot. So we have available slots in every waiver, but for ABIQ, right now we have 96 slots available. We have 264 that are they're filled and in use. These 23 that are reserved are people that have had they have a slot that's been allocated to them and they're working their way through the process. So they may be getting their level of care determination done. They may be finishing Medicaid eligibility, but they have not started accessing services yet. So for ABI LTC, we have 413, 15 that are in the process. We have 10 available slots. HCB, so right now we have 15,484 that are filled. Reserved, we have 1,254, and then available, we have 312. For Model 2, of course, this is our smallest waiver. We are only serving about 20 people right now. We have one in the process, and so we have 79 slots there. For Michelle P, and I do want to make a note on Michelle P and SCL. So right now we're showing the slots is 10,500. We are still pending the 100 slots that we had received in the budget. The waivers had never made it all the way through the approval process. So this is going to go up to 10,600 once we receive the waiver approvals from CMS. But as of right now, we have 9,919 receiving services. We have 136 that are currently in process with 445 slots available. SCL, so again, right now our number is 4941, but it will go up once we receive that approval back from CMS. We have 4804 that are actually receiving services, 42 in process with 95 slots available.
Pam, are those 100 slots, is that from the last biennium budget session?
It is. It
Okay.
is. What has happened is the waivers, because of how we were in the process of the renewals, and then the direction came out with changing, how Appendix K, they wanted us to submit Appendix K. So we never had actually got those all the way through the approval process with CMS. So that is the actual slots from the slots the current budget year, or the current budget that we're in.
Okay, thank you.
So before I talk about the wait list, I want to say, or give the numbers, I want to say just a couple of things. Right now, we only have 2 waivers with the wait list, which are Michelle P and SCL. I think that sometimes just hearing wait list, people think, okay, they really are waiting for services. And so they may be waiting for something, but to get on a wait list, the individual doesn't go through a full eligibility screening. So for example, it's a targeting criteria. So for example, for Michelle P, they demonstrate that they have an intellectual or a developmental disability, but we may not have all of the supporting documentation, and we've not done that functional assessment yet. So just because someone's on the wait list does not guarantee that the individual is going to meet level of care criteria once that slot has been allocated and the full assessment's been completed. And then also, of course, an individual must meet Medicaid eligibility in a type of assistance that supports waiver services. Once, even if they do meet level of care, they also have to be eligible for Medicaid. So right now, our Michelle P wait list, and this is, again, numbers as of yesterday, there are 8,781 on Michelle P. For SCL, there are 3,356. We do not have anybody waiting in the emergency category. There are 81 in urgent and 3,275 in future planning. At any point in time, any individual that's on either the urgent or the future planning list for SCL, or a new person applying in general, can apply to be on to get emergency status for SCL. So that's why you see there's a wait list, but it's to be held for those emergency slots. We are currently working with BDID and looking at, once the new slots get approved, how many we'll have, how many we normally allocate, to see if there's potential that we can allocate some off of that urgent list. We are also looking at revamping the wait list process in general, so that all of the waivers have really the afforded option of kind of an emergency status, so that if they need something immediately, that they are able to get to those services sooner. Something else I want to share about the wait list is, it's a stat that we have just recently started getting consistently, that I have a dashboard with Waiver, but the number of individuals that are actually have Medicaid eligibility today that are on the wait list, and the number of individuals that are on a wait list, but they're receiving services in another waiver. So for Michelle P, 84% of the individuals, so 84% of that 8,781 of the individuals have some type of Medicaid eligibility and the ability to access services. Of those two groups, there's an additional 29% that are either receiving waiver services in a different waiver right now, or are in the process of, they've just had their level of care, or their capacity has been assigned, so they haven't made it all the way through to the point that they're actually receiving services, but they've initiated that process. For SCL, 93% of the individuals, so 93% of the 3,356 individuals on that wait list have Medicaid eligibility. Of that, additionally, 75% of those individuals are receiving services or are in the process of receiving services from another waiver. And I think before, Dr. Schuster, before I skip down to the SMI, the public comment, I know there's a question about the public the responses to public comment. We were working yesterday evening, kind of cleaning up those and formatting them into the kind of in the groups where it makes sense, where like comments are together, and we are targeting having those out either by the end of this week or Monday at the latest. I believe we ended up receiving about 200 comments, somewhere between 175 and 200. Some of those, when you see the response, some of those were able to be combined into one response, but we received a lot of very valuable feedback this time. It's some of the better public response that we've had in a while, and was there were some very thought out, some very good comments that we received. So we were very excited for that, and it did inform some changes. We did make some changes based on some of those comments.
Okay, that's good to know, because we were encouraging people to make comments, and it's always nice for people to hear that they were received, and we'll be getting that feedback from you all. You want to go on and talk about the 1915I at this point?
I can do that.
And
Yes.
I want to call in Veronica Cecil with a comment on Appendix K.
Yes. So just real quick, I'll go through what the state, for the individuals that don't know what the state plan of the 1915I state plan amendment is. It is a way for a different Medicaid eligibility group to receive home and community-based services. We define the supports and services included in the benefit. We offer the benefit statewide to eligible individuals. So when services are offered within the Medicaid state plan, so via state plan amendment, they are available statewide, and there are no capped slots. So that's one of the things that, one of the key differences between the C waiver and the I is that, so, for example, Michelle P, there's 10,500 slots. For the 1915I, there's not a capped number of slots. So it is available to all individuals that meet the criteria. The other key difference is that it's a way to offer home and community-based services to people who do not yet meet institutional level of care. So they're not, while they need significant supports, in some cases, or maybe not as significant supports, but they do need those supports to remain successful in the community. They do not have to qualify for that institutional level of care like an individual who's on a 1915C waiver does. So we're going to offer 3 different housing related services. And this really will be person-centered, will be based on, the level of need at the participant, that the participant needs at that point in time. It may, you may see someone go from one level to another. They may start at the lowest level. They may start at the highest level, and that may be what they need to continue to support them. So it's really going to be based on the individual. So we'll have supervised residential care. So that's 24/7 staffed care. There's individual support to help with transitions. The housing model, everything that we are doing with housing is based on permanent supported housing principles. And we realize that, a lot of people don't think that supervised residential fits into that model as well. However, there will be some of those individuals that may need that in the beginning, and they may do, step through the other models, or they may need that always to be successful. So we want to make sure that this waiver is inclusive and that it covers all of those needs. The second model is tenancy supports. So pre-tenancy and tenancy sustaining supports. So helping them to identify, obtain housing, and to sustain their housing. So, remembering to pay the bills, helping with those relationships with their landlords, and everything that we don't think about that comes with maintaining your housing. And then in-home independent living support. So this is for individuals that are either living with someone or living independently on their own in an apartment or in housing. It will provide some assistance with ADLs and IADLs. And so it is really the least restrictive of the housing models. So in addition to the housing supports, there are these additional services. So supported education, so support to promote engagement, sustain the participation, and restore the individual's ability to function in a learning environment. Supported employment, following the IPS model, we're to offer supports and services to obtain and maintain employment in a competitive environment. Looking at transportation, so non-medical transportation services that'll provide access to covered non-medical community services, activities, and resources. Medication management, so we feel like in this population in particular, the adherence to medication is very important. So providing that support and education to facilitate adherence to medication treatment regimens. temporary respite for caregivers. So provide opportunities for caregivers to receive temporary respite. Anybody that knows me knows respite is like one of my soapbox services, because one, you can't be a good caregiver for someone if you don't have time for yourself. And two, I think we all deserve a break from each other sometimes, even when you're just family members. So assistive technology. So looking at what kind of equipment, software, what kinds of products are out there to improve functional capability, support education, employment, recreation, ADLs. I'm amazed constantly at some of the new functionality or the new technology that's out there that really enables individuals to be independent. Will support the individual to gain the needed supports that will help develop that and monitor that person-centered service plan and enable them to identify the goals and strategies that they want to meet and what their objectives are and how they want to get there. So where have we been and where are we going? So we have completed the policy review and comparative state research. We've had targeted stakeholder peer state interviews. We've interviewed many stakeholders, got a lot of great feedback. We've had multiple strategic design sessions. We are designing and drafting the SPA components right now. Next month, so in all the next, I think it's the next slide, I've got the dates on it, and we are going to share those out again. We've shared them once, but we have some information to add. We're going to have the information sessions across Kentucky, and then we will have, after we have those, we will conduct the formal public comment process, just like you just saw with the 1915C. So all of the comments and everything that we have heard up through this has been a part of the development of the SPA and has been considered into the SPA. So even comments that we take while we're in the information sessions, those will be part of that formal public comment as well. We will incorporate those. So here's what our sessions look like. So the 6th of December and the 7th of December, we're going to be in Moorhead and Richmond. Northern Kentucky, we had a little snafu because Pam didn't look at the calendar when she was thinking about dates and did not think about the 12th being Inauguration Day. So we're gonna move that one. It's looking like it's probably gonna be the 11th, so probably that Monday instead of Tuesday. Louisville, we are finalizing our location, but it is going to be on the 13th of December. And then our final session will be on the 14th of December. 2 of the locations we're going to offer virtual attendance options. We are finalizing kind of where we're going to have the best connectivity to make sure that those will be the most successful. And so that the links to those will go out, as well as the revised schedule confirming that date, in fact, will be the 11th. And then the location for Louisville. So we're hoping to have all of that nailed down by the end of this week so that can go out. So, of course, our Medicaid public comment at ky.gov. If you have any questions or there's any feedback that you want to give us before we have the sessions, we will be doing questions during the sessions. I think we're kind of been playing around with how best to do that because I want to capture them in writing. So I think we're going to have a couple different options. One where you can kind of scan a QR code and go out and you could log a comment or log a question, as well as having just some cards where we can capture them in writing just so that we capture the full intent of the comment and it doesn't get misheard if somebody's writing it down, because we want to capture all that information. And that is it.
That's a lot, Pam, and thank you so much. I do want to point out to people that Medicaid public comment at ky.gov is a place to ask any questions about the SMI 1915I, but also to register your comments about it. So thank you for that, very thorough. And I understand that you all will be sharing those slides with KBH and Thrive so that we can send them out to everyone. I think.
Yes,
let
I
me-
will do that.
Yes, thank you.
I can do that. It was a running down to the last minute of getting everything on the
Well,
slide.
it's a lot of information. Thank you. Very quickly, I want to ask Senior Deputy Commissioner Veronica Judy Cecil, because I think you had a brief update, Veronica, on the Appendix K.
Yes, and I actually have it as kind of part of the overall, but I can pull these out since we're talking waivers.
Oh, okay.
I
Thank
can
you.
go ahead and pull these two out. And for those interested in Appendix K, which was the vehicle in which we extended a lot of flexibilities for just the 1915C home and community-based services waivers. I think the two key things to note is we did file all 6 waivers with CMS. I believe it was November 9th. They were due November 11th. So Pam and the team did a phenomenal job of looking through all the public comments, making some adjustments to the waivers, and then getting them to CMS by the due date. And that was a huge task. So we have submitted those. We've asked for an effective date of 4/1/24 to give us enough time to implement the waiver and work with CMS on approval, get us through the holidays. And so we have no idea when CMS will be able to turn these around, because keep in mind, all states pretty much who want to extend the flexibilities past November 11th have filed their waivers with CMS. So we're not sure how long it's going to take for them to work through all those. But just to note, and these slides will be shared as well, is that this is to be able to extend the flexibility, certain flexibilities past the November 11th date. So this is a list of what those flexibilities are, and we'll continue. There is separate stakeholder meetings related to the Appendix K flexibilities and the waivers, and we'll continue with those and keep folks updated through that process. But wanted to share those couple of things.
Thank you very much. Let me very quickly call on Deputy Secretary Leslie. I made you a deputy secretary. I just promoted you, Leslie.
I'll take that.
Deputy Commissioner Leslie Hoffman,
Yeah.
very briefly about
Yeah,
the SUD waiver.
Got a little bit of information for you too. And just a reminder, we've got 145 folks on the call. So just a reminder, there is a companion SMI 1115 that will work along beside Pam's 1915I for other services like recuperative care and parity with our IMD. So I just wanted to let you know that. And it is still with CMS. Nothing back yet. And we submitted that in May. So, okay, just real quick, I am in public comment, or we are in public comment period right now. So I can't say a whole lot or take a whole lot of comments in the chat or anything like that. I need everybody to follow our formal process. And as soon as I get off the call, get through speaking, then I'll send that to you in the link so that you have the information, Dr. Schuster. Just real quick, because we've got a lot of folks on. If you remember, we submitted the 1115 SUD amendment for incarceration 3 years ago. That is now referred to as Kentucky's reentry 1115. So it's now for a broader population than SUD, and this was no small feat and nothing that was done in a short period of time. We worked with CMS. In March of 2023, CMS finally came out with guidance. So it was 2.5 years before we got guidance on exactly how they wanted us to make that happen. So I just wanted to let you all know that. So from the state Medicaid director letter and CMS is kind of how we decided how we were going to drive forward. Our waiver goals were to increase coverage and continuity of coverage post release, to improve care coordination and communication between the carceral setting and the community services outside, and addressing any health related social determinants of health needs that we could along the way. So we've finished all of our stakeholders engagements. Now, remember, this is a huge feat that we have Medicaid several of our sister agencies that have given more than 100%, and actually folks in other cabinets. We've got DOC, AOC, DJJ. So this has been a huge initiative. So it took us a while to figure out how the systems were going to look. Eligibility will be for adults in the state prisons and youth in the youth development centers. Services will include case management 60 days prior to release. This is our request. 12 months post-release. We will cover MAT, which will be the medication plus the therapies, 60 days prior to release. We are asking for a 30-day supply of all medications at the time of release. So, Dr. Schuster, that includes the physical, the behavioral health medications, and any durable medical equipment orders that they might need. We are also including a recovery resident support, which we call RRSS, up to 3 months post-release, and that is part of Senate Bill 90 and Senate Bill 248. So we're addressing several Senate bills and House bills in this. And then we have House Bill 3 and Senate Bill 162 that addresses the juvenile justice. So that's why the juvenile justice were added at the same time, as they are equally important to get this moving. So our plan right now is that we have our public comment out right now. And again, I can't answer a lot of questions, but I need you to go through the formal process. CMS, we are expecting, if they follow suit like they did 3 years ago, they will also go out with a 30-day federal public comment, which you all can comment on that one again as well. Once approved, even if CMS approved it, and I'm just giving you an example, if CMS approved it tomorrow, it doesn't mean that we can implement. We have a 90-day time frame, I believe, to complete an implementation plan. We have to do a reinvestment plan. And so all of those things have to be sent into CMS, approved before we can go live. So I don't have a lot of time frames for you right now, but I just let you know that this is very exciting. I'm so glad that we are finally here. We have completed this, the things that we think CMS will approve, and then we can always build upon it. So this will now be under our Team Kentucky overarching 1115 for multiple populations, not just SUD. So I just wanted to let you know that. And I'm going to, can I share my screen real quick? Am I allowed to do that? Just real quick. Or do you want me to, I can just send it.
Yeah, why don't you send it, because Priscilla and Commissioner
okay, that's fine. The public forums and information will be on this. I'll send it to you now. Okay.
Right. All right.
Thank you. Have a great day.
Thank you. That's exciting stuff.
Yes, yes,
and I'm sorry we don't have more time to get into it, but let me throw the pass over to Priscilla. And I apologize that we're running late here.
Priscilla, your audio is not working.
Oh, wait, can you hear me now?
Yep, you're in business.
Okay, great. Thank you. Sorry about that. I'm so glad that you called me out before I went too much further in this. So I'm very excited to be able to go over Medicaid renewals. I know we don't have a lot of time, but we've been talking about it all year so far. So a lot of this information is not new, but we will have a chance to go over to hear a more thorough overview next month at our annual meeting, if you're able to join us. I think someone might, Kelly, could you put the link in the chat to register if you haven't? There will be a session on Medicaid renewals there, so we can have a way more in-depth conversation here, a way more in-depth update at that point. And the state also has their monthly stakeholder meeting this Thursday. So that's also a great chance to hear a lot of this information. You know, Medicaid renewals have restarted back in all the way in April now. I cannot believe it's November. And a lot has changed since then. So I want to turn it over to Senior Deputy Commissioner Veronica Judy Cecil to give us a brief update, as much as you can share in this time. And yeah, can you tell us a little bit more about what has changed since the first quarter? What does recent data look like? How have things been going right now?
Sure thing. Happy to do that. I will quickly, and we'll share, I've got a long slide presentation because we're talking unwinding. I love to talk unwinding, but I'll just go through a key things, and I appreciate Priscilla, you all gave us some key things to focus on, and that's what we'll try to do in the shorter amount of time that we have left. First of all, I want to note that there are, since we met last August, this past August, that there are some really great new flexibilities and strategies we've implemented that are really, I think, very key to helping us and helping our members as we navigate the restart of renewals. The big one I really want to talk about is we, starting October 1, we are suspending child renewals. And what that means is that we are going to go ahead and push a child 12 months and grant them continuous coverage. So we have implemented continuous coverage for children in Medicaid, but a child would have to go through a renewal first and be determined eligible before we could grant them the eligibility period. So now what we have decided to do for just the period of the unwinding, so that's from October to April 2024, we are able to go ahead and just suspend that child's renewal and grant them that 12 months. So they'll automatically be pushed ahead 12 months, and their coverage will only stop for the 4 reasons that apply to continuous coverage. So they age out, turn 19, somebody asks for them to be disenrolled, like a parent or guardian, they move out of state, or if the child dies. So that's a really great, I think, new flexibility that we're able to use for children. The other thing I want to talk about is that what we have decided to do as part of our states have a lot of discretion in how they allocated the cases across the unwinding period. So we are going to use that discretion, and for December renewals, we're going to redistribute the majority of those cases across the rest of the unwinding period. Those are primarily be redistributed between February, March, and April, a few in January for other reasons. But so it doesn't mean you won't see terminations in December, because we are still going to do a December renewal if they're aligned to another program. So if they have SNAP or TANF renewal at the same time, we did not want to separate those renewals, because the caseworker only has to touch them once, if they're a combined renewal. So we have maintained a caseload in December if they were aligned to another program. You will also see that we are going to allow for the determination of ineligibility based on income, and qualify for a qualified health plan, or eligible for a qualified health plan with advanced premium tax credit. So you're going to still see terminations. You will also see terminations from those who have been and exhausted any extensions until December. So you'll note on the slide, we also have extensions going on. So if somebody has not responded to a notice, instead of just procedurally terminating them, we are allowed to extend them for all populations 1 month. Now for our long-term care and 1915C waivers members, we're able to extend them up to 3 months. We were doing 2 months. We got approval from CMS to extend that for additional 3 months. So additional months. So that allows us to continue to work with those individuals to try to get that notice responded to, that renewal notice back, and work through the issues they might be having, getting that returned to us. So we're excited about that. Moving over the waiver flexibilities. This is just kind of the snapshot of our CMS monthly report. So this is a snapshot in time for each month as we file the CMS monthly reports. If you want to understand what just happened during a reporting period, we are filing those on our website. It's done by the 8th of the month is when we have to submit it to CMS, and it reports what happened in the previous month. So we now have, I think just the newest number is October. And just to note, we have a large number of approvals, a smaller number of terminations. Our pending number is high because of those extensions. Again, if we hadn't received a response to notice from someone in August or September, we might have been able to continue to extend them. So that pending bucket does continue to grow. Important thing to note. Oh, go ahead.
Sorry, quick question. If you go back, for those who were extended in September, it was a 30-day extension. So are they included in that October number? Or is that a separate
No,
bucket?
they are not. No.
Okay.
It's a great question, and I'm glad you noted that. So what has been difficult for the CMS monthly reports is there is no place for us to report if we've now since approved somebody or terminated somebody that was in that pending or extended category. CMS just issued guidance to states starting after December 29th. There will be a way for states to report that. So I think it's helpful. It's going to allow people to really track how many people are being approved or terminated. So we're looking forward to that. But no, when you see the individual renewals, those are who were initiated for that month of renewals, and it doesn't include any previous months.
Perfect. Thank you.
Great question. Just always want to note to folks that there's that 90-day reinstatement period. So if somebody was procedurally terminated and comes in and can provide that information for us, we can reinstate them back for 90 days. Should be automatic. They shouldn't have to ask for it. Doesn't always happen, I know, but they are eligible for that. So we're tracking the reinstatements. Obviously, May and June have now closed, the 90-day period have closed, but you can see that we're, even for October, it's November 14th, and we're already seeing some reinstatements as a result of that. So we're always encouraging folks to do that. We have a new demographic report. Wanted to point that out. I won't go through it today, but we started with September renewals, and so now we'll be issuing one for every month going forward. The October one should be posted in the next week. We're still working on it. So I think what you'll note from here, it is a good way just to kind of see where we are with race, gender, and ethnicity and age group. Largest number, not surprisingly, is between 26 and 50 years old. That's a very large number, a large number of age just group, but it's important to note for them that they are the ones that are more likely to have employer-sponsored insurance to go to or to a qualified health plan. So just keep that in mind. But just overall trends to date, 83% renewed by ex parte. We have 43% of our terminations are based on actual determination of ineligibility. Our procedural reasons, 57% sounds kind of high, and most of those are due to not responding to that notice. We continue to work on ways to address that, making sure that we have the most current address, that we're reaching folks when we do our outreach. So still working through that. I did want to note, because of the flexibility, especially with the December redistribution, we have updated what the projected caseload looks like going forward. So just wanted to note that. You asked about other, if people leave Medicaid, what's happening to them if they've been terminated. And we're doing our best to try to get some insight into that. And one of the ways we're doing that is for tracking fee-for-service and MCOs on if somebody shows they have third-party liability. So they have other credible coverage. We're not counting if they have a dental plan or a vision plan. They have an actual comprehensive healthcare plan on file with us as a third-party liability. So we are trying to track those numbers. And again, I think just lets us know that if they're at least losing Medicaid coverage, they might have something else available to them. And one of those is a qualified health plan. So the good news is as we're seeing our Medicaid numbers kind of trend down, we're seeing our qualified health plan numbers trend up. And we'd still like to see more go and choose that health plan and get the coverage through the qualified health plan. at least it again trending up. This really shows, this is as of November 10th, we're in open enrollment. We already have over 1,000 people that are brand new to QHP, so to the marketplace. So that's always great to see. So just to say, we're in open enrollment now through January 16th, 2024. There is always the unwinding special enrollment period that's ongoing, and that goes through July 31st. So if somebody loses Medicaid at any time, like they could have already lost it, but guess what? They have an unwinding special enrollment period. So if beyond open enrollment, that window between January 16th and July 31st, if they were terminated at any time for Medicaid during that period of time, they could do a special enrollment due to unwinding. Our call center has added Saturday hours. And so now they are open 8 to 5 on Saturday, as well as the DCBS contact center is open on Saturdays already. So I don't know, like I said, I got a lot of information still to go over. So I don't know if you want me to try to narrow in on anything in particular.
No, I think we are running a little over time, but if you can share those slides with us,
yep,
we will make sure to send those out. And just a friendly reminder, you do have your stakeholder meeting this Thursday at 11 a.m. at the Teams meeting. Someone put the link in the chat, but we'll also make sure to send the link out with the follow-up email. And then next month on December 5th, we have KBH has our annual meeting, and we will also have a more detailed Medicaid renewal. Thank you for running through those numbers so quickly and sharing so much great information. I think we need to wrap it up, so I will pass it over to Emily.
Yes, I'm sorry, I'm in a room with some other folks.
You sound fine. It's not echoing for us.
Oh, good. Okay. So I'm just going to say thank you. I know we're over time. You'll get a follow-up. And anything that wasn't addressed today, Senate Joint Resolution 54, dental vision hearing regs, we'll get you updates on that as well. So thank you. I hope to see many of you next month, December 5th, at our annual meeting. And we also have our virtual roadshow in December. So more information on all of that will be in your email soon. Thanks so much. Bye, everyone.